Okay, there are several reasons that can explain this. What is most important is that we understand what is supposed to be a beauty evaluation and who is to be considered a beauty therapist or a hairdresser. To become a beauty therapist or hairdresser, by the norms of the vocational training ministry in Cameroon, you should have done 12 months of training. And by the norms of our school, the Chango Hair Beauty and Fashion School and Academy, you must have done 2,500 hours of practical theory and field work. All of that makes you competent in a number of things. You have to master the human biology of the skin you're working, the chemistry of the cosmetics, the equipment technology, and customer service, that is the rapport, and then all the treatment protocols. This is just a quick summary, which means you understand skin lesions, not dermatological problems, you need to understand them, and then the causes. From that point of view, you realize that a therapeutic service should not end up with that result. Anytime that you have a result like that, there has been gambling because somebody is using what they do not understand or practicing a procedure that's not appropriate. I can bet you. It's not because they are wearing a white, overall and they are, they say, or they have opened a beauty salon. Their knowledge isn't there because these are all avoidable problems. When it comes to inflammations or eruptions on the skin, there are a number of things. It can either be a chemical aggression, it can either be a physical aggression, or it can be a bacterial infection. And in the case of bombs, for shaving bombs, there's something that has to do with the physiology of the hair follicle. Africans have a follicle. A follicle is that room from which the hair grows. It's like a pocket. They call it an invagination of the skin. From that pocket where the hair grows, there is a shape which is like curved. So when the hair is growing out, it follows that curve until it comes out. When you shave using certain shaving methods like blade, the hair is cut below the skin. And the hair, when it's growing out, because it is curved, it moves back into the follicle. They call it an ingrowing hair. And it wounds the lining, which is not very protected because it is not keratinized skin. Hair outside, when you shave with a clipper, the hair is cut above the skin. You can always touch it there. It's not very smooth like a razor cut. And when the hair, even if it is curved, it won't break through the skin because the epidermis is resistant. When it's below the follicle, when it's inside the follicle, it will grow into the skin, and that is like a wound. And what happens? There's an infection because the skin hygiene may not be up to date. So generally, they are disinfectants, skin disinfectants that after shaving can be used. And if the skin hygiene is appropriate, the bacterial infection will not take place and it will heal. But this is not always the case because men don't have a grooming habit of cleansing, toning, moisturizing, or disinfecting every morning like women. So most of the time, you realize that when you do this type of shaving on some people, it won't have bumps because their hair grows straight. There are some people that don't have very kinky hair. So most people have very coarse beards. They easily have these bumps problems. So it's very important that the esthetician or the hairdresser or the barber be able to tell the client who will have bumps not to do a low shave. That's with a blade. They should use a clipper shave. And if they must follow a skin hygiene discipline that's very strict to improve on it. So the other issues that can come up is that you use aggressive, like in facial cleansing, aggressive detergents as cleansers. They first of all can dehydrate the skin. They can be very, very nocive because the detergent may be, I used to say there are detergents for washing cars and carpets. Just look at when you do laundry. Sometimes your hands are completely dry and damaged. But imagine that there are some detergents for the face, cleansers for the face that carry very hot, very aggressive detergents. It can break the immune system of the skin. They call it the hydrolipidic film. And when that film is damaged, the skin is exposed to infection. And of course, normally, it will develop inflammation because of infection. And if it is physically aggressive, it is scrubs, very harsh scrubbing procedures or harsh scrubs. It may be, a high frequency or galvanic equipment that end up burning or irritating the skin.